Joining me, I'm Dr. Amit Arwindekar. I am the Medical Director over North America for UnitedHealthcare's Global Solutions. We are the business within UnitedHealthcare which helps employees who are not citizens where they are working, so cross-border employees and business travelers. So we have an expertise in helping make sure that they stay healthy, that they stay safe, and when they access healthcare, that they are going to places that they can trust. And will get the appropriate care for their needs. What I'm going to talk about today is the vaccine for COVID-19 and return to work. And the reality of our situation is that we've been really traumatized over the last year by the changes that have happened to our communities, between having to reorganize how we work, having economies shut down, having businesses shut down, and we're struggling to get back up. But the vaccine really is our way out, and we can't have a discussion about return to work unless we're having a discussion first about the vaccine and what is possible, what is out there. So in the next slide, we're going to just start with a brief overview of the vaccine. Just to give everyone an idea of where we're going to go over the next 15 to 20 minutes or so, we're going to talk about the state of the vaccine first, worldwide, not just within the United States. Then we're going to talk about return to work, what it's going to take, and we're going to discuss an example where we helped one of our clients get back to work using some of the services that we offer and some of the guidelines that are out there in the workplace. And finally, we're going to finish up by having a discussion about what will this look like long term. So once the vaccine is completely rolled out, what do we expect the world to look like when we are all able to go back into the office, not just here in the short term? So for the state of the global state of the vaccine, the next slide will show us where the vaccines are from. In the United States, we've discussed a lot about two vaccines, the Moderna vaccine and the Pfizer vaccine. Those are the two that are approved for use in the United States. The good news here actually is that there are 8 vaccines which are approved around the world. The AstraZeneca vaccine by Oxford, made in the UK, has been approved in parts of Europe. The Russian companies have 2 vaccines which are currently being deployed over parts of Eastern Europe and in Russia. The Chinese have 2 vaccines which have been deployed across China. And then India has a vaccine which they have also developed internally. The Johnson & Johnson vaccine has made a lot of headlines over the last 24 to 72 hours because they have applied for EUA in the United States and hopefully will be deployed in other areas as well. This map is showing you currently where the vaccines were produced. It is not showing you where these vaccines are available. That map is growing rapidly. And we refer all of you to our global intelligence websites if you want to see what is available in around the world in various places that you may have employees or want to send employees. The other good news is that almost all of these all of these vaccines meet the minimum requirement from the World Health Organization to help stop the pandemic, which is they're at least 50% effective in stopping transmission or severe illness, which is the cutoff we need to help ourselves get out of the situation that we're in. So with 8 already, several more in the pipeline, there is a lot of good news for our ability to vaccinate and get people back to work, back to a work site. Our next slide is going to talk about what's coming in the future. There are currently 48 vaccines that are in clinical trials around the world. Now, what's important about this slide, and I want you to pay attention to, is all of those colored spots on the map are where these trials are taking place. We've heard a lot in the last few weeks about vaccine variants that have developed in the UK, in South Africa, in Brazil, in parts of the United States. A vaccine that was only developed in one place would be limited because it would not be able to account for the different variations that are occurring around the world. The fact that we are testing our vaccines around the world is giving us a step ahead so that we're hopefully not going to have to vaccinate and then revaccinate and revaccinate again because the vaccines that we develop are not current. Some of these vaccines have been tested in South Africa, as you can tell, in Brazil, in the United States, and in the UK, places where these new mutations are coming up. And we are, as a medical community, staying one step ahead so that we can take care of our population and bring an end to the pandemic. The final point I'm going to make about vaccines is that if you are able to, if your number comes up, if it's accessible to you, please get vaccinated, as this is our way out of the current pandemic. Okay, our next slide, we're going to start talking about what this, the vaccine rollout plan. This is the CDC's US vaccine rollout plan. It actually includes 3 phases, but we're just going to focus on phase 1, which is the phase we're in right now. Phase 1A was essential workers, healthcare professionals, and nursing home residents who are in high risk for transmission and poor outcomes. That phase, we've moved out of that phase in most parts of the United States right now in phase 1B and 1C, which includes people who are at risk, have medical conditions, and who are essential workers. What's really, I think, important to note about this phase is not the details, but the numbers. So we are in a phase right now, 1B to 1C, which includes, when you combine them, 180 million Americans. Once we complete phase 1, we'll have vaccinated almost 200 million Americans, which is more than half the population. This is where we're at right now. Like, we have made it a priority to get vaccine into as many people as possible, especially those at risk, and it is widely available. This is very good news for us as we look at returning to work. Dr. Migliore showed us, where the vaccine is available, where we've seen penetration of the vaccine, but this is a work in progress. And as we push through the end of 1C, that is really going to give us a chance to start opening up a lot more of the world, a lot more of our businesses, a lot more of our communities, and return to something closer to the life that we have previously known.